Welcome to Week 4, which is our Introduction to Qualitative Research. In our previous session in Week 3, we looked at quantitative research, which most people are more familiar with. We often think of research results being presented as numbers and statistics. In contrast, qualitative research reports its results using themes or descriptions. In other words, they use words to report the results. So in this session, we will try to cover 4 objectives concerning qualitative research. The first is a definition of qualitative research. What is qualitative research? How do we define it? Secondly, we will look at the rationale. When should we use qualitative research to answer our research question? Why should we use qualitative research? The third objective is comparing between quantitative and qualitative research. Knowing the difference between quantitative and qualitative research will help us choose an appropriate study design. The last objective would be understanding the components of qualitative research. What kinds of skills and knowledge do we need when we do qualitative research? Okay, so what is qualitative research all about? How should we define it? If you see this definition here, from Denzin and Lincoln, it summarizes some of the key characteristics of qualitative research for us. Firstly, qualitative research is multi-method in focus. This means we use many different methods of collecting, analyzing, and reporting our data. For example, if you analyze a newspaper article, it will be very different from how you would analyze an interview or a recorded conversation. Secondly, qualitative research is interpretive and naturalistic. This means that qualitative researchers try to study things in their natural settings. They attempt to make sense or interpret certain phenomena or happening in terms of the meanings that people bring to them. Needless to say, the focus of qualitative research is on subjective matters. Qualitative researchers are interested in the different perspectives from which people look at the things around them. I like to emphasize here that you, as a researcher, are the key instrument in qualitative research. You are applying your interpretation and your understanding to a subjective research matter or a research interest. For this reason, it's very important for qualitative researchers to be reflexive, which is a way of saying that you must consciously be aware of how things like your background, your beliefs, your values shape or influence the way you conduct your research. Thus, we can see that the research question asks about the what, the how, or the why of a certain phenomenon, but rarely or almost never about the how many or how frequent of a certain research topic. Qualitative research, therefore, is concerned with process rather than simply outcomes or measurements. I'd like us to look at this slide. This next slide shows us the example of our average Joe patient who is worried about a heart attack that he may or may not get. I'm going to use this slide to explain the merits of quantitative and qualitative research to us. On one side, on the left side of the slide, we have a very large group of patients who have all been measured for the same outcomes. Such quantitative data, such quantitative studies are very important and can give you population data which you then can apply to your individual patient. Now, for example, based on statistical data, on population data, the risk of your average Joe getting a heart attack, given his BMI, his cholesterol, and other factors, would be stratified into low, medium, or high risk. Let's say that your patient has got a high risk of heart attack. After knowing this, you can give him some advice on how he should lower his risk by living a healthier lifestyle, for example. That's quantitative research. However, quantitative research cannot tell you about how or why the individual does or does not want to act on the advice that you have given him. We have questions like, what are they concerned about? Why won't this patient give up his unhealthy lifestyle? These are questions which quantitative studies just cannot answer. And these questions are very much the domain of qualitative studies. You can find out how patients view things such as advice, how they view things such as health, and also why patients may choose to act or not act in a certain way. Now, one common misconception is that research areas are strictly divided into quantitative or qualitative methods. For example, anything lab-based is quantitative, while any kind of research on health behavior is qualitative. However, this is not necessarily true. I like us to think of quantitative and qualitative research as two neighbors. Although they come from the same postcode, they have their different ways of doing things. Thus, qualitative and quantitative research may come from the same research area. For example, people are looking at diabetes, or child abuse, or breast cancer, but there are key differences between how people study things in these areas. Let's compare some of these differences to help us understand the difference between quanti and quali research.
The rationale for quantitative studies is to test out if a hypothesis or a pre-existing theory is valid or not. On the other hand, qualitative research is exploratory in nature, and very often little is known about the topic of interest. Thus, the reason for conducting quantitative research is to look at quantifiable relationships, such as cause and effect or associations. Qualitative research, meanwhile, seeks to generate new theories or models based on the exploration of the topic. Quantitative data is objective and is reported in numbers, while qualitative data is subjective and the results are described in words. When it comes to quantitative research, we know that the results from the sample may be generalizable to a larger population based on the rigor and sampling framework of the study. However, qualitative results are almost never generalizable, as these results are constrained to a specific time, place, and people, besides looking at very subjective topic matters. Besides looking at the characteristics of qualitative and quantitative research, we can also differentiate them by the flow of the research process. In quantitative studies, the flow is deductive. This means that the research flows from a general or broad base to producing smaller specific results. In the diagram, the theory is a broad description of an area of interest. When research is conducted, this flows into a hypothesis, which is then measured through observation, finally giving rise to a set of results which may confirm or disprove the hypothesis. This then applies to the theory as a modification or a confirmation. So, broad theory to specific confirmation. In qualitative research, the flow is inductive. The flow is from specific to general, which is a reverse of deductive research. Qualitative research starts with many specific observations, which then give rise to patterns which the researcher can use to form a theory about the area of research. New observations or samples can then be sought from which to continue improving this model or theory.
When is it appropriate to use a qualitative approach? I'm sure that you have been able to guess some of the areas by now after listening to the comparison between quantitative research and qualitative research. But in summary, a qualitative approach is more appropriate if all or some of the following criteria describe your topic of interest. Firstly, is your topic of interest a new field? This means that when you try to search for the literature or when you talk to experts in the field, very little research has been done in this area. And as far as you can see, there's no substantive theory or model to explain this area of interest. The second reason for using qualitative approach would be the context of the study being what we call very messy. This is where it's very difficult to conduct research in a controlled environment, and the researcher will need flexibility in adapting to changes or new findings as the research is being conducted in unstructured and complicated environments. Think of a messy hospital, a busy clinic. Would you be able to control for every single factor? The third reason for using qualitative approach is when perspective matters. Perspective has a lot to do with understanding how and why people act or react the way they do. Qualitative research seeks to learn from these participants, seeks to learn from the people experiencing these things in a setting or in a process according to how they experience it. The fourth reason is theory generation. As I mentioned before, qualitative research is an inductive process. It seeks to construct theoretical frameworks or models that reflect reality as much as possible. The fifth reason is to go in depth. Qualitative research is concerned about understanding a phenomenon deeply. So when I say in depth, what do I mean? By depth, I mean we seek to understand not only the full range of factors or influencing reasons behind a certain phenomena, but also the thick understanding of a phenomena, which means that we are not going for the superficial understanding or just a surface level understanding of a phenomena. When I say thick, this means that we seek to describe in detail the patterns, the underlying patterns of social and cultural relationships, and put these into the context of the study. On the other hand, we also want to point out that there will be, and there are, poor reasons for doing qualitative research, for choosing qualitative research. For example, if you know what is being hypothesized and what you are likely to find, or if you do not need to know the complexity of people's understanding, or if you are testing prior theory rather than constructing new frameworks, or if you are simply describing a situation rather than deeply analyzing it, then it's possible that you should not be working with a qualitative methodology. We also want to say here that you should be careful of doing qualitative research for the wrong reasons altogether. For example, some researchers I know have said, I want to do qualitative research because I hate statistics, or I can't use computers. These are wrong reasons. Rather, your choice of research approach should depend on which design is most appropriate to your research question.